You've heard people talk about dental crowns, but if you don't have any yourself, you may not know exactly what they are. So, Dr. Jason Northcutt from Robertsdale Dental is joining us. And Robertsdale Dental, by the way, a regional center for dental excellence. And you're going to explain, so what is the purpose of a crown?
A crown, Cherish, is a covering for the whole tooth.
Okay.
When the tooth is broken down through maybe an old restoration or staining, or there's many different reasons you could have a crown, but it's a covering, and they're very pretty, they're very durable, and we do a lot of crowns.
And they look natural?
They look beautiful.
Okay, and you put together a video to give everyone a little more in-depth explanation of exactly what a crown is. So take a look at this.
A crown is really the natural progression of restorations in teeth. You start off with baby teeth, you get a little cavity, you put a filling in that tooth. Well, at 6, 7, 8 years, 9, depending on which tooth it is, it's lost, and then a new permanent tooth comes in. Say that tooth gets a cavity as well when you get on up in your teenage years. You get a small filling, and later on in your 20s, that one wears out. You go in and have filling replaced, and it gets bigger. Every time we drill it out, we clean out decay from around an old filling, and we lose more tooth structure, and it weakens the tooth. Crown's just a natural evolution of the life cycle of a tooth. A crown is essentially a covering for the whole tooth. The tooth has either a large filling that's old and leaking and worn out, or it's got a big cavity. For whatever reason, there's not enough healthy tooth remaining to put a filling in. We get all the bad stuff out, get down to healthy tooth structure, then we'll place a buildup, just filling in the areas that have been destroyed or damaged over the years. And once we get to a healthy size again, we can shape that. We'll make an impression of the tooth, and we'll send that to our lab, and the lab will fabricate the crown. And there's different kinds of crowns. Some are made of different materials. There's all ceramic. Those are the prettiest crowns that we have. The most durable probably are the porcelain fused to metal, very pretty. When we put crowns on teeth, there's several benefits. One of the benefits is it gives us so much more control over the entire area right around that tooth, especially in between the teeth, because it allows the lab to contour the tooth so that the floss glides smoothly. It really has a nice contact with the teeth next door on each side, and that alone prevents food from getting packed in there so tightly. Sometimes with a filling, the material just won't allow us to work with it in such a way to sculpt and to artistically and mechanically do the things that we can do with a crown. So much better in terms of protection, not only protection, but also the art and the beauty of the tooth, and keeping food out of the gum area as well.
And crowns are something that you specialize in.
We do a lot of crowns in my office, and one of the best feelings is when a patient has not been happy with their smile, and we can change all of that, and it just boosts the confidence. It boosts their self-esteem, and you can visibly watch shoulders come back and eyes brighten, and that's one of the most rewarding things that we get to do as dentists.
Dr. Northcutt's address and phone number right there. You can see them on your screen, and we'll also add his contact information to our Studio 10 page on fox10tv.com.